This is James Beattie. I'm joined here by Dr. Robert Moffit, who is a senior fellow here at the Foundation for Domestic Affairs. Dr. Moffit, it's good to be with you here at Heritage in Washington.
Thank you very much.
Now,
James.
I met you last year at a Hands Off Our Healthcare forum in Paramus, and it's good to be with you all the way here over a year later.
That's right.
Now, we've seen a lot of things going on. We're less than 50 days out to the election.
Right.
And a lot of things are going to be focused on the election. The debates are coming up very soon. 3 presidential debates, a vice presidential debate to complement it. A lot of things will be going on to focus in on it. Foreign policy, of course. But one of the things we're going to be talking about today is Medicare and the Affordable Care Act, ObamaCare, if you will. Now, the president has gained in part some popularity across the country for shouting down Congress, condemning Congress, among other things, Medicare, not getting any reform, accomplishing any reform. Clearly a problem acknowledged on both sides of the aisle. Republicans, Democrats both know about it. Now, why haven't any solutions come to fruition, been put forth, with the president's first term coming to a close?
Well, I think the main reason is that on Medicare reform, you have a clash at a very, very basic level of visions on how the Medicare program should be reformed. On the one hand, the president feels that basically what we ought to do is we ought to maintain existing financing and regulatory arrangements and simply expand them over time, including the creation of an independent payment advisory board that would enforce budget caps.
That's known as IPAB. That's what Sarah Palin has called death panel.
Yeah, I mean, I think that's unnecessary language. I mean,
right.
The real story here is that the IPAB will not make any kind of decisions about benefits or medical treatments or procedures, but what it can do, and what it will do, is make determinations about what the payment will be for doctors, hospitals, clinics, home health agencies, nursing homes, and so on. So, in effect, it is a very, very powerful board, a 15-member appointed board that will have these kinds of decision-making authorities. Their job is to make sure that the Medicare payment system does not grow, the Medicare payment doesn't grow, or Medicare spending doesn't grow beyond whatever the budget requires, and the budget will be set at the growth of the economy plus 1%. It's a pretty stiff budget. The other idea is to say, look, if you're going to get healthcare costs under control, why not use market forces? Why not inject market forces to create efficiency in the system by forcing, really, or compelling health insurance companies, providers, hospitals, clinics, agencies to compete directly for consumers' dollars, and that the system is to a large extent insulated from any kind of real competition. This would be an opportunity to do that, and that competition would at least slow the growth in healthcare cost, but even more so, a competitive system will give you better value for the dollars that you're spending, that over time you'll get more and better healthcare for fewer and fewer expenditures of dollars.
Now, the Obama administration would say, well, to that point, they're going to take away the health care. The Republicans, conservatives are going to take away what is health care now and force you to go to a company and go out there.
Yeah, the fact of the matter is that, well, there's nothing to that, actually. The truth is that if you look, for example, at most Medicare premium support proposals, Medicare reform proposals, including the Ryan proposal, Medicare, the traditional Medicare program is retained. It is not something that goes away. The Medicare benefits package itself becomes a necessary condition in the Ryan proposal for even setting the government payment. You can't have a government contribution system that is based outside of that, outside of that competitive bid on Medicare, traditional Medicare benefits. So it's hard to see how any senior citizen, for example, could possibly be worse off than they are today, because they're going to be guaranteed the Medicare benefit levels today, and they'll be able to get better Medicare. They'll be able to get better Medicare benefits tomorrow because they can buy richer plans with more varied benefits over time.
Now, you've said that it's hard to believe that any senior could believe that. In today's Washington Post, that's this Friday, the 28th of September, the front fold, that most of the seniors in key swing states, Ohio, Florida, etc., want Medicare to remain as is. Yeah. Now, why has the Obama administration been effective in persevering this sort of narrative?
I think so. I think what's happening is the politicians are talking past the public. Let me explain why I say that. You say Medicare as it is. What is Medicare as it is? Medicare is basically a combination of a government fee-for-service program, right, which is the traditional Medicare program, Medicare Part A and Part B, plus, in almost 9 out of 10 cases, private health insurance. So the current system today is not a government program. It's a private sector, public sector partnership in delivering health care to senior citizens. If you enroll in Medicare, Medicare has tremendous gaps in coverage. There are a lot of things that Medicare does not cover. The most important gap in coverage in Medicare today is that Medicare does not provide any catastrophic coverage. In other words, if you get very, very sick with a highly expensive illness, Medicare does not cover that. You have to have coverage outside of Medicare to cover those enormous catastrophic costs. Well, that's why almost 9 out of 10 seniors today buy supplemental health insurance coverage, which not only covers their
Medicare supplement you're talking
supplemental health, yeah, that's private insurance. These private companies, basically what they do is they provide wraparound coverage for the traditional Medicare program that fill in the gaps in coverage, that can reduce premiums and co-payments for Medicare beneficiaries, and at the same time provide catastrophic coverage. That's what Medicare is today. Are most senior citizens happy with that? Yes. But you've got to realize, of course, that an awful lot of what seniors are happy about is the security that they get not from the traditional Medicare program, but from the private coverage that guarantees them a peace of mind because it protects them against catastrophic illness. Absolutely. Now, what the Medicare reformers, including Congressman Ryan, have proposed is to mandate that all health plans, including the traditional Medicare, have catastrophic coverage. That's a benefit addition compared to what we have today. A lot of senior citizens don't understand it, but I think it's true. Senior citizens often love Medicare, but they don't often understand how it works. They don't understand how it operates. They don't understand how much it costs, really. And they don't understand what, in many cases, they don't understand. Too many people do not understand that the current system, the way we have it today, is really not financially sustainable. And this is not my view. The president himself has said that unless we reform Medicare, right, it will not be here for future generations.
You talk a little bit about financial unsustainability. In one of your latest briefs on Heritage, that the baby boomer generation, about 77 million,
start retiring this year.
And some already have started retiring.
Right.
I've worked briefly in the insurance sales industry. There's demand for medical service over the next two decades, putting unsubstantiated strains, unprecedented strains over the Medicare services.
Yeah.
Now, you say enrollment is expected to jump from 48 million up to from last year to 81 million by 2030.
That's right.
And you could potentially make Medicare insolvent by as early as 2017.
Right.
Now, how come there's no outcry over this particular issue? You're not hearing too much talk about it. You're saying, well, the Republicans and conservatives all they want to do is outsource Medicare, if you will, like we've been discussing.
I think this is a dereliction of duty on the part of, it's a dereliction of duty on the part of a lot of public officials. I mean, not just Democrats, but Republicans too.
Sure.
We've let this go for too long. What has happened, I remember when I was in the Reagan administration, back in the 1980s, I was at the Department of Health and Human Services, and we talked about the baby boomers. I remember it very, very clearly. It's seared on my memory. I remember that the actuaries at the Department of Health and Human Services would literally sweat blood over the future of the Medicare program when the first wave of the baby boomers, 77 million of them, start to retire. The issue is, good Lord, how can we sustain this? Because there are a bunch of things happening all at once. It's kind of like the perfect storm. One is, of course, is you have this massive expansion of new retirees. The baby boom generation is starting to go on the system. And they are the big demographic challenge. Medicare is manageable today. With the baby boomers, you're talking about, again, 77 million people going onto this system. At the same time, people are living longer. When Medicare was created in 1965, the normal longevity, people normally live to about 70 years of age, roughly. Now, looking at 2030, it's going to be over 80 years of age. So we're talking about a large number of people who are going to be living much, much longer. But what makes the problem even more severe is that the number of workers that are required to sustain each beneficiary in retirement is shrinking. Right now, it's roughly between 3 and 4 to 1, 3 and 4 workers to basically pay the bills for each retiree. But by 2030, it's going to drop down to roughly 2 workers for every retiree. Now, what this means, James, is that unless we make some very serious changes now and start to prepare for this now, it means that one of 2 things are guaranteed, possibly 2, is that we will have crushing tax increases on the working population to keep the system afloat. Or we will have, like they're having in Europe right now, severe, savage budget cuts, which are going to basically cut into the benefits of current and future retirees. I don't think either of those alternatives are attractive, which is why we ought to start to gradually reform the Medicare program starting today. We have to start as quickly as possible.
We've talked about this in good length. Just as a, kind of to cap this a little bit, Washington Post Kaiser poll recently stated a 58-42% margin. Medicare in its current form, we've talked about that a little bit, is favored over what we call a voucher system. Voucher's kind of been almost compromised to a 4-letter word. It's almost a curse word, if you will. One of those 7 words you can't say on television. It shouldn't be changed to a voucher system, which the government guarantees each year a fixed amount. Talk about that a little bit.
Well, it's nonsense. Let me put it this way. I mean, voucher is a scare word. I'm sure it was the product of a group of political consultants sat around and, with a focus group and said, here's what's going to happen. In the future, the government's going to give you a piece of paper, a form, a certificate, and you will go out in the open market and pick some kind of health insurance. You'll have to negotiate with some big bad health insurance company all by yourself. Now, if you ask people, are you in favor of a system like that? Most people will say, no, I don't think so. The truth of the matter is that nobody is actually proposing this type of system. And we've had some really crazy things being said in public about, what Medicare reform would look like. There was a congressman in Indiana by the name of Joseph Donnelly who said that senior citizens in the future are going to be given coupons to buy health insurance. At the Democratic National Convention, there was a woman who said that we have guaranteed benefits in Medicare, and those guaranteed benefits are going to be replaced by a book of coupons. I mean, right. Now, vouchers actually we use vouchers, for example, in the food stamp program. Today, we have a food stamp program, which is basically a voucher program. We give people coupons, and they go out and they buy food if they're eligible for the coupons. Right. And it's an entitlement. And, whether it works good or bad is a separate question, but we do have it in public policy. There is no Medicare reform proposal, none, 0, nada, that would rely on issuing vouchers, forms, certificates, little pieces of paper to people to go out and negotiate with health insurance companies on their own. What Medicare reform advocates are talking about, including Ryan, is to say that, in effect, we'll have a defined contribution system where the government actually makes a contribution to the health care plan of your choice, You decide where the money's going, but in fact, it's going to be an automatic transfer from
comparable
the treasury.
to Part D?
It's exactly like Part D. There's not one senior today in Part D who gets a voucher. There's no senior who gets a voucher for Medicare Advantage. I was in the Federal Employee Health Benefits Program for 11 years myself. I never got a voucher. But to listen to some of the propaganda, you would think that that's the way the system operates. If you take it seriously, I mean, and this stuff is such nonsense, it's hard to take it seriously, but unfortunately, too many people do. Well, actually, most senior citizens are in a voucher program as defined by the opponents of reform already. It's just, they don't know it.
Absolutely,
right. And why? Because they're in 90% of all seniors, almost all seniors who are looking at this program have drug coverage. 90% of them do. The vast majority of that coverage comes through private health insurance. It's either their employer's plan, which gets a subsidy, or it's a private plan that they pick for their drug coverage. There's 1,100 of them in 34 regions of the country, that offer health insurance or drug coverage right now. So we actually, the incredible thing is that if what Ryan has proposed as a voucher, well then most senior citizens are already in such a system. They just don't know it. And I'm not surprised that they're satisfied, because the evidence is overwhelming that people who are in Medicare Advantage, people who are in the Medicare drug program, are highly satisfied with their coverage. They love it, but it's all being delivered by private plans.
And like you said, I'm not sure it's going to be there when I come around. Now, it comes as no surprise that you and other like-minded people in this building are highly critical of the Affordable Care Act, ObamaCare, if you will. Now, someone from a Center for American Progress, Emily Oshima Lee, liberal think tank, for those of you not familiar with it, has lauded the benefits 2 years after its passing and lists a whole thing, citing various points. 73 of young adults are back with their insurance, 6.6 million, including 1.3 million minorities. Creation of pre-existing condition insurance plan, the pre-existing insurance plan. Funded 190 construction and renovation projects at health centers, 67 completely new health center sites being created. Over the next 2 years, it'll support over 485 new construction and renovation projects, 3 million new patients at community health centers, with an additional 1.3 million expected over the next 2 years. 19,000 new jobs they both created. This goes on and on. This sounds like a pretty good deal, Doc. I don't know, I think we're doing pretty, according to Emily Lee here, we're doing pretty good. What's the beef?
Well, what's the beef is that the economic incentives that are hardwired into the system, the new taxes, we're talking about anywhere between $700 and $1 trillion of new taxes over the next 10 years, about 22 different taxes in the system, is going to have a tremendously negative effect on the economy. The medical device tax right now, which is 2.3%, it's supposed to go into effect in 2013, is going to hit medical device industries, and you're going to see layoffs. They've already announced layoffs. Hospitals are actually firing people in anticipation of the hospital payment.
Can you give some sort of example?
Well, there was one, I believe, in Indiana. I don't remember the exact. Okay. I can find it, but there was one that announced that because of the payment cuts to hospitals, that they're going to have to start to cut back on their staffers, and so you have that taking place. The law also eliminated physician specialty hospitals. There were all kinds of hospitals that were under construction, where these hospitals were run by physicians and they were specialized for things like cardiology and orthopedic surgery. Because of the law, those hospital construction programs have gone under. But those are minor things. The big thing is that Americans are going to be faced with huge tax increases very soon, beginning in 2013, real big tax increases. And it's going to be one of the largest tax increases in the history of the United States. Tax increases of that magnitude are going to negatively affect the healthcare sector of the economy and employment generally throughout the economy. Employers who are going to be faced with mandates and the benefit packages that are going to be required by law are going to have to make some very serious decisions about whether they can expand or not, because the employer mandate affects all companies with 50 or more employees. Companies that are smaller than that are not going to expand because they don't want to come under the mandate. So we're already seeing a depressing economic effect in some of these cases. No, I think that as an economic matter, what is going to happen is we're going to have higher health care costs, we're going to have higher taxes, we're going to have higher premiums, no question about it. And all the benefits that are so-called free benefits, there are no such thing as free benefits. When they basically enriched or enhanced the drug benefit by reducing the donut hole or closing up the donut hole in the Medicare Part D program, that does not, in and of itself, mean that drugs are cheaper. When you enhance the benefit, you increase the cost, which means you're going to increase the premium. Well, the Congressional Budget Office did us a favor. They said, yeah, all these very attractive benefits in Medicare Part D, it's going to add about 9% to the cost of Medicare premiums, and who pays that? Seniors. So there's no such thing as a free lunch, as they say, and so we're going to be getting pretty significant bills for this.
I suppose not. The person that wants the president's job, Mitt Romney, states on his website that he's going to empower the states to make their own decisions regarding health care. It's one of his day one statements. Do you see this as a reality?
I think let me put it to you this way, without having he has not explained specifically what he has in mind, but I will tell you this. The most important thing to remember about the Affordable Care Act is that it transfers vast regulatory and discretionary authority to the Department of Health and Human Services. The Secretary of the Department of Health and Human Services is one of the most powerful public officials in the United States as a result of the Affordable Care Act. She can determine what the health care benefits packages look like. She can determine what's in it, what medical treatments and procedures are going to be covered, what are not going to be covered. She can determine what preventive services are going to be. As you know, that HHS has just issued a mandate that applies to religious institutions that says, in effect, that they must cover abortifacients. They must cover sterilization, whether they want to or not, or contraception. This is a very powerful agency. But the key thing to remember here, James, is that the Secretary of HHS is given very broad discretionary authority in enforcing this law. So, I don't know exactly what, Governor Romney has in mind specifically, but I do know this, is that simply by changing regulatory direction, he can really have a profound impact on the implementation of the law on day one if he is elected. But of course, administrative waivers administrative waivers do not solve the problem. What we have to do in this case is the only way that you're really going to get back on track is to basically repeal the law and start fresh and get it right. Because right now we don't have it right. So and the status quo ante, what we had before, is not acceptable either.
Do you expect any parts of Obamacare that absolutely can't be repealed as it is now?
Actually, theoretically, no. I think there are parts of Obamacare that are very, very popular that you could substitute alternative plans for that frankly make no sense, and that's what I'd be in favor of. I mean, I think there are certain.
What would those be?
Well, for example, the whole question of risk pooling and so on. Okay. What we want to do is we want to make sure that people who have pre-existing conditions are not excluded from coverage. And Obamacare does that. There's no question about that. But the point is, do you have to do it the way they did it? No. I would give the states a lot more authority in this area. And I think one of the points that Governor Romney has made, which is a very important point, is that the states have the potential to be great laboratories of innovation in healthcare policy. They can do a lot of new and different things. And they can do that precisely because of they can do different things in an environment where we can learn a lot about what works and what doesn't. The founding fathers of the American Republic wanted to create a federal system. One, because it was based on states that had were pre-existing, but build the federal system because it would, number one, protect liberty by decentralizing power, but secondly, there was a public policy reason. It was the opportunity to have diversity in public policy on matters that affected the people of the states. That's where I think Governor Romney is hit it exactly right. That is where we have to have some real innovation. There's a lot of areas where we can experiment in healthcare, particularly in providing safety net care to the poorest and the most vulnerable citizens among us. That's where we can really do some really interesting and innovative things.
This is one of the things that the Obama administration likes to come about. They said, we took this from Heritage, we took this from Romney, this sort of mandate.
Oh, the mandate. Well, Heritage actually did in 1989, back in 1989, and they cited the 1989 or 1988. It goes to show you how desperate they were. I went back to 1989 to cite a Heritage report in which we said there would be a legal requirement for a mandate. That's true. We did propose that. We did propose that in 1989. However, we did it in the context of two important things. These things are not separable. One is that the mandate that we proposed was to protect the taxpayer against the free rider. In other words, people walking into a hospital emergency room and running up hundreds of thousands of dollars worth of medical bills and then shifting all that onto the taxpayer. We need some protection from that, and there are ways to go about it, but that was one thing. The second thing is we proposed the mandate not only as a protection against the impact of a free rider, but we also proposed it narrowly within the context of a fundamental reform of the tax treatment of health insurance. In other words, what Heritage was proposing then, still does, is a situation where you would get tax relief for health insurance regardless of where you got it, whether you got it from your employer or whether you got it from a trade association, a professional organization, even a religious institution. That's where you would get it, and you would get tax relief for that. So it was designed to open up the market. Now, as years went by, Heritage decided to drop it, and in 2001, my boss, Stuart Butler, published a major report, which was a second version of the Heritage Foundation, and we dropped the individual mandate in 2001. My boss also spoke before the American Medical Association in 2004 and told the AMA that we were no longer supporting an individual mandate. And when the individual mandate was adopted in Massachusetts, the first Heritage publication on the Massachusetts Health Plan, our analysis of it, we came out against the Massachusetts individual mandate. But so, the truth is that the Obama administration, probably President Obama got the idea not from something that Heritage had written in 1989. My guess is he got the idea from Senator Hillary Clinton, who he had been fighting with vigorously throughout the Democratic primaries in 2008, who was a stalwart champion of the individual mandate when Barack Obama was saying that he was opposed to it, very, very strongly opposed to it throughout the 2008 presidential elections. So I think Hillary is probably a closer source of Obama's newfound love and respect for the individual mandate.
Newfound love. Newfound love. There's, I guess, a couple of questions to wrap things up. Now, last year, we mentioned at the top that we met up in New Jersey, that Hands Off My Healthcare event sponsored by the West Bergen Tea Party and Americans for Prosperity in New Jersey, Mayor Lonigan, Pagoda, former Mayor Lonigan. Now, one of the things you stressed to me when I spoke with you briefly, that it transfers power to the government, as you stated. Now, one of the things you stated is, it's a vehicle sort of for cronyism.
Oh, yeah.
1,400 waivers granted last year for various companies, unions, close to the Obama administration, or play nice with them.
Restaurants, very boutique restaurants in San Francisco.
Yeah. Where's
actually 1,700 now.
Is it up to,
it's well over 1,700.
Now, where's the outcry on this?
Well, there has been. I mean, a lot of people, it's becoming actually the story is not over. The special interest lobbying, the special deals, all of that is coming to light. I think that the Republicans on the House Energy and Commerce Committee deserve a huge amount of credit by showing how some of this backroom dealing and cronyism has affected, the healthcare debate. In the case of, for example, the insurance companies, they insisted on the individual mandate as essential because, frankly, they would not have been able to. They say basically that they would not have been able to maintain their profit margins without the individual mandate. You had a situation with the pharmaceuticals, where the pharmaceuticals had made a special deal with the administration for their support. So you had, what you basically have seen is special interest group lobbying on steroids under this administration, specifically with regard to the Affordable Care Act.
I guess just to wrap it up, how do you see both Obamacare and Medicare in the context of the upcoming debates, and how can it affect next year?
I think, well, first of all, to be very frank, none of Medicare's fiscal problems are going away. My concern is that people will be more deeply confused because it is a complex issue. But here's the fact. The fact is that forget the national debt for a moment, which is bad enough. $16 trillion.
17 now, I believe.
So, well, 16 last I've seen. But anyway, forget the national debt. One other huge burden is the unfunded liabilities of the Medicare program. That is the promised benefits. That amount represents the promised benefits that are not paid for. The Medicare actuary, who deserves a Congressional Medal of Honor, great man, Richard Foster, has said that the unfunded liability of the Medicare program alone is $37 trillion. That means that over the next 75 years, we've got to figure out how to come up with $37 trillion. And the truth of the matter is, James, there's no way that we're going to be able to do that if we keep doing what we're doing. We're looking at a collapse of the program. We're looking at hot war or high taxes or savage benefit cuts. Nobody wants any of that. That's why the best thing to do is to start to reform the system now. I think, frankly, that Congressman Ryan's proposal of saying, wait 10 years, I think that's a mistake. Actually, I think that we should have a much shorter window. That's my view. So, but there is no doubt that Medicare is not going to be able to absorb, a doubling of the population. Its enrollment without some major changes. And the other problem that I think that senior citizens have to worry about is that a lot of physicians are rethinking their careers. There was a report yesterday from the Physicians Foundation, which indicated that 6 out of 10 physicians are very dissatisfied with their work environment. And Medicare and the Affordable Care Act are contributing to this. Many physicians, more than half, do not want to take new Medicare patients.
Well, how much do you get for Medicare reimbursement? It's going down from about 85 to 55 now.
85, well, if they don't make a change. See, Medicare's reimbursement for doctors is doctors get paid 80% of what they would normally get on the private sector market, and if they were getting it from a private payer. So Medicare pays 20% below, but the point is that if the Medicare payments formula remains the same,
right,
then it will fall to 55%. Well, that is getting into areas of payment, the lower levels of reimbursement that are very similar to the welfare program, Medicaid. And the problem is that people who are on Medicaid, which is a welfare program, about 1/3 of them can't find a doctor to take care of them. So we're looking at replicating that disaster in Medicare unless we really start to change the system. And we have to do it.
Are you optimistic?
I'm optimistic. I know that, I'm optimistic. I'm optimistic because I know that, people have, people are stuck in their ways. They want to sort of live in the 1960s and, pretend that nothing's happened, But the other side of it is this, is that just looking at spending in general and the economy in general and the debt in general, our friends at the Congressional Budget Office, they're very temperate and mild in their language. But they say things in very calm language, which actually, would set off panic and hysteria if it were said with any more oomph, so to speak.
Absolutely, yeah.
But they say, their most recent budget update says that if we continue current policies, not current law, but current policies, that the debt to economy, the debt to GDP ratio, instead of being 100%, will be 200% by 2037. If that should happen, it's the end of the United States. We cannot survive that. Greece right now is 150%, the debt in Greece is 150% of its economy. In 2037, if we go to 200% of our, we can't survive as a free and democratic republic. The America that we know will not survive.
Well, on that wonderful note.
No, but there's opportunities here for change.
Right.
And that's what we have to do. We have to have, and I'll tell you, whoever becomes president in the next 4 years, they're going to have an enormous job ahead of them.
Right.
The president's going to have to multitask more so than ever before. But the number one domestic issue for the next president is going to be to put America's fiscal house in order, because if we don't, all the other problems become much, much more, much greater.
Dr. Moffit, the Heritage Foundation, it's good to talk with you about these issues, really delve into them. Some of us, it's probably a little heavier than for others, but it's really important to know this. It's the foundation of our country. It is our country. It's our future. Yeah. And we really appreciate talking about this with you.
Thank you.
Come
Thank
back
you, James.
sometime.
I certainly will.
Absolutely. It's good to be here at the Heritage Foundation, and keep logging on to Save Jersey for so much more coverage.